which private practice was closed immediately. In the private practice, he has 104 patients who are contacts. In the private practice, in Victoria side at maternity and theatre, he has 22 staff members who are contacts and 21 patients. So it's 21 patients plus 104. It gives you the totality of patients. Then staff, it's 22 in Victoria. Staff of Victoria is not counted with the staff of Mahikeng Provincial Hospital because it's two separate areas. The position as of now too is that maternity and theatre in Victoria are going to be closed for decontamination. The private practice is already closed. So you have a situation where both workers, communities, and everyone else in Ngaka and in Mahikeng specifically must now take it that we are confirming that this doctor tested positive. And in fact, before you ask me, the reason for the test was on the basis that the employee in the private practice had tested positive. What is going to be done now is that the 3 areas in Mahikeng Provincial Hospital closed for decontamination. We then take over everything. In fact, contact tracing has already started. That's why I'm giving you your primary results of who is contacted. Maternity and theatre in Victoria will be closed. That's as far as the issue of the new health professional, which is a doctor based in Mahikeng Provincial Hospital and Victoria. Furthermore, there are 2 cases of public interest involving SABC officers in the province. One is in Madibeng. I know some people went there in the morning. And the other is in Matlosana. Madibeng case involves 47-year-old female police officer. Female police officer. The patient was isolated at JST pending transfer to La Femme, Pelegai, and is in stable condition. The case in Matlosana involves a 37-year-old female police officer who was deployed to Matlosana. Contact listing is done, and the office is managing those issues that pertains to contact listing. Now, this is 2 police stations. It's police stations. A decision independent by SABC was taken on both of them. They took a decision on Bratz. They took a decision on the one in Matlosana, on the facilities. But contact tracing of all, it's our responsibility. What we want to record is that we are not happy at all. First, whenever numbers of COVID-19 do increase, we're not happy, either in the country or in the province, because that's not our plan. Our plan is preventative measures, health education, and ensuring that our people do play their part in contributing to flattening the curve. That's one area that is a problem to us. Now that you know that we already had 1 death, we don't count numbers. Whenever we lose life, we will never celebrate, irrespective of the number of people we lose. But what is critical is that the community categories, that have been categorized as being too risky. Those that are in the elder ages and those that are using chronic medications and those that have sicknesses that they currently have, to ensure that they play part in cushioning themselves and in ensuring that they will never be exposed to COVID-19, because risk detects that if they are exposed, it might be difficult to control how they survive post that process. So it's an individual process. We're calling for individuals, but too, as government, we're working on that. Secondly, beyond this one, I don't want you to ask me something I did not tell you, because you have questions that you have that are moving. First, there's something that is called consequence management. On consequence management, based on the reports we have, we then take decisions. There's cases that have invited media. The first one is when we employ a person, we do not ask membership of a political party. And if we were to use membership of a political party on discipline, we will not be able to control how to impose discipline on employees. I am now meeting with you as media. I do not care which party you vote for, which party you are a member of. I'm addressing media. And this applies to in discipline in the Department of Health North West. We don't ask people their membership, because if we were to do that, we will then be encroaching in political vengeance, which it's not sustainable for any department to do it. That's the first one. Secondly, when employed people are paid on each day, none of them write to political parties and say, I am your member, I'm now paid. Here is my salary. The attitude then of writing to a political group when you are suspended and say, I am your member in good standing, should never be encouraged to be allowed to be done by public servants. Must never be done. So there's two categories of suspensions that have attracted people. The first one, in the IDTS, which is infrastructure, 3 people were suspended, but at the level of the director, it's 2. In the suspension, everyone has reasons. And when a suspension says it's precautionary suspension pending an investigation, it means it's not yet a disciplinary process in terms of the law. You are suspended to stay aside whilst the investigation on what you are accused on carries on. When that process is finished, which is also regulated by law, when it is finished, it's either, it's 2 ways. It's that the investigation proves grounds for you to be disciplined, therefore you are going to be given a notice. Or the investigation does not find any grounds for you to go to a disciplinary hearing. You will then be told to come back. So in this instance, these employees got precautionary suspensions. In the IDTS, it's on an investigation we are doing, which has to do with the contract management in a contract we have to construct Macon. That's the matter that is under investigation. It's contract management. You can ask me, what is the problem in contract management? At face value, the main problem is that escalation fees were paid in advance. That's what they're investigating. That escalation fees are paid in advance. That's a separate on IDTS. The second category, which has brought many interests, is the ones that CFO, Director Supply Chain, and an official who is a secretary of the bid adjudication, still under that unit. The three are suspended precautionary on the basis of the investigation in the tender of the security. What is being investigated again? It's an element of dereliction of duty, which is represented by the fact that supply chain letters of appointments were issued to entities, with some entities with inflated prices. That's what is under investigation. Some entities.
We come out of that briefing by North West Provincial Health MEC Madoda Sambata as he's speaking about the tensions taking place in hospitals and reiterating from his side that he believes that no one gets hired on a basis of their political affiliation, and asking for people to stop entering party politics using their jobs. So applications for the 350 Rand unemployment grant can be sent to the new SASSA WhatsApp number 082 084. My apologies. The new